Ready? Start. The year 2024 marks a significant milestone for immunization programs both globally and in India. It commemorates 50 years since the launch of the expanded program on immunization EPI by the World Health Organization WHO in 1974. The EPI was introduced as the eradication of smallpox virus was on the horizon and a need to leverage the then immunization infrastructure and a trained workforce was recognized to expand the benefit of available vaccines. Following the announcement, nearly every country across the world initiated its national immunization program. India launched the EPI in 1978, which was later renamed as the Universal Immunization Program UIP in 1985. In India, this year is also 2 decades since the country conducted the last nationwide independent field evaluation of the UIP in collaboration with international experts. This is an opportune movement to access the progress made and envision the future. Globally and in India, there has been significant progress in terms of the impact of immunization and vaccines. While in 1974 there were vaccines to prevent 6 diseases, 5 decades later, there are vaccines against 13 diseases which are universally recommended, and vaccines against 17 additional diseases are recommended for a context specific situation. There is research in progress to develop vaccines against nearly 125 pathogens. Many world prevent diseases prevalent in low and middle income countries. The children with 3 doses of DPT, a tracer indicator of coverage, has been rising over these years. In the early 1970s, around 5% of children in low and middle income countries had received 3 doses of DPT, which increased to 84% in 2022 at the global level. Smallpox has been eradicated, polio eliminated from all but 2 countries, and many vaccine preventable diseases have nearly disappeared. In India, the coverage has increased every passing year, and in 2019 21, 76% of children received the recommended vaccines. Since the launch of EPI, studies have shown that vaccines have saved millions of lives and prevented billions of hospital visits and hospitalizations. Economic analysis have estimated that vaccines are highly cost effective interventions, with every single dollar or rupee of expenditure on vaccination programs ensuring a 7 to 11 fold return. In nearly all low and middle income countries, including India, the immunization program remains a success among all government initiatives, nearly always with far greater coverage than any other health program. Moreover, in mixed health systems with both the public and private sector, delivering services, immunization often remains the only health intervention with greater utilization from the government sector. For instance, in India, the share of the private sector in overall health services is nearly two-thirds. However, nearly 85% to 94% of all vaccines are delivered from government facilities. Experts often argue that the immunization coverage is a tracer indicator of the possible highest coverage any government intervention can achieve in a given setting. Yet, it is not without challenges. In early 2023, the UNICEF's The State of the World's Children report revealed a concerning trend. For the first time in more than a decade, the childhood immunization coverage had declined in 2021. In 2022, globally, an estimated 14.3 million children were zero dose, did not receive any recommended vaccine, while another 6.2 million children were partially immunized. Over the years, the vaccination coverage in India has increased both nationally and state wise. However, there are persisting inequities in coverage by geography, socio-economic strata, and other parameters which demand urgent interventions. It is interesting that when it comes to vaccination, people often and wrongly believe that the vaccines are only for children only. The truth is that in nearly 225 years since the availability of the first vaccine against smallpox in 1798, vaccines have always been available for individuals of all age groups, including adults. The first anti rabies vaccine, cholera, and typhoid vaccines developed between 1880s to mid 1890s were primarily for adults. The first vaccine ever developed in any part of the world against plague in 1897 was from India and meant for individuals across all age groups. The BCG vaccine against tuberculosis was first introduced in a nationwide campaign in 1951 and was also administered to the adult population. Influenza vaccines have always been administered to adults and children alike. This history clearly illustrates that vaccines have always been intended for individuals of all age groups. Stop.